This is Dr. Sara Siddiqui, and I wanted to thank the Elwood Public Library for inviting me and asking me to speak a little bit about children and the current COVID-19 epidemic. I'm a pediatrician in Huntington, and I've been in practice for almost 20 years. And I do enjoy seeing all of my patients at work, and I miss you guys. I miss everybody. Let me start off by saying that this doesn't, oh, thank you. Hi. I just wanted to start off by saying that this obviously doesn't replace any medical advice given by your primary practice provider. I'm here to just kind of give some information and just let you know that we're here for you. Pediatricians, all medical providers are all here for you. Please reach out to them if you have any specific concerns. I do have a few questions that were sent in by the staff of Elwood Public Library, so I wanted to begin with that. But I also wanted to say that this current epidemic or pandemic is not, it's a marathon, okay? It's not a race, it's a marathon. So you have to kind of take it slow and steady. You know, I hope everybody's all well and staying healthy and you know, being okay at home. I know it's difficult, and I know it's tough for children, especially. Well, it's tough for all of us, but I think when you have kids at home not used to their usual routine, it gets to be a little difficult for everybody involved. So I also want to start off by saying what I say to all my new moms when they come in with their baby, with their newborn baby. I do try to say that you do have to practice self-care. So, you know, as a mom and a parent and a pediatrician, you have to make sure that you're filling your own cup. So the analogy I give a lot at work is when you're on the aircraft, you know, we haven't been on that in a while, but if you remember, they always kind of suggest that when the oxygen masks, when the masks come down, to put your own mask on first. So I just wanted to start with that. So you want to make sure that your own mask is on first before you put even your child's mask on. And that's because you want to make sure that you have enough oxygen and enough in you to help the people around you. So you really want to make sure that that's happening. So I see that we have some people on here already. I'm not really sure how to scroll up. Oh, there we go. Okay. And I see Eric is on here. Thank you, Eric, for your technological assistance on this. So yeah, let's begin. Again, I wanted to make sure that you know that this doesn't replace any medical advice from your primary practice provider. And as we kind of go through some of the questions, I wanted to let you know that your medical providers are available for you. We ourselves are doing a lot of telehealth visits as well as some in-person visits, and we really try to keep you safe when you come to our office. All right, so if anybody that's watching, yeah, hi, I can see some of the comments. And anybody that's watching that would like to ask a question, I'm completely comfortable with you guys asking questions as well as we go forward. I do have some questions that I have prepared already, but if there's any specific issues that you wanted me to address, I will try to do my best, as we all are trying to do right now. And that's another thing that I wanted to make sure that everybody knows. Everybody's doing the best that they can. So, as far as your kids studying, doing the homeschooling, the teachers performing that, all our essential workers, the people that are staying home doing the social distancing, and the people that are working, going to work, and the people that are, day to day, the grocery store workers, the garbage men, the everybody that's coming together and doing their share. They're all doing the best that they can with a lot of the struggles that we're all feeling. So yeah, there's that. Okay, so one of the questions that I received was, what is the most common presenting symptom of coronavirus in children? So first of all, thankfully, children do not get as sick with coronavirus or COVID-19. Thankfully, they can present some signs and symptoms. And for the most part, they could be low-grade fever, sometimes even a little bit of a higher fever, cough. They can even be congested. Sometimes they can have trouble breathing. So in that case, you do want to really reach out to your doctor or pediatrician, or give a call, or we can do a telehealth visit. But it's really important to note that they generally have mild symptoms. We have noticed, or there have been some observations of children with asthma that may have a little bit more of a severe presentation. But even that, they've found that they do pretty well as also, making sure that they're taking their normal medications. But that's a really good, that we've been thankful for from the beginning. There have been reports of younger infants, so children under 1 can develop a little bit more severity in their illness if they do present. So you want to look for that age group, you do want to look for extreme fussiness. Any temperature, even a low grade, you do want to call your doctor. And what's even more important to know is the reason behind the schools closing and maintaining social distancing is because children can be asymptomatic carriers. So children may not even have any type of signs, and they could be carriers, or they could be positive for COVID-19, which we have been finding. And that's one of the main reasons why we do want to keep everybody distanced and make sure they're not interacting with either grandparents or people that are immunocompromised closely at all. So we really want to be careful on that. Is the length of recovery time the same in children and adults? Oh, okay. I will get to that, Mr. Andrew. I see that. All right, I will get to that. So is the length of recovery time the same in children and adults? So as I said, the kids don't usually present with that many symptoms, but we have been seeing that some of the children that do have some body aches and pains, or low-grade temperatures, or even some fatigue, nausea, they can have those symptoms for up to 2 to 3 weeks even. So they can be a little bit prolonged, and we've been seeing that in the adults as well. Sometimes the symptoms can persist. They don't show up for that 14-day. We all know that it can take up to 14 days to present with symptoms once you may have been in contact with it. Symptoms can present, but they can persist for a good 2 to 3 weeks even, and even beyond that, depending on how your own body is. And what signs and symptoms should parents look out for in children with suspected coronavirus? So let's say you were able to, because in the initial phases, when New York was, starting to become, we had more and more people that were becoming positive. There were children being tested, and some of them were asymptomatic. So, or they hadn't yet come down with any symptoms, but they were being tested because the parent may have been positive. So if a child is suspected to be positive but does not have symptoms, that's great. But the symptoms that you do want to look for, again, are fever, cough, shortness of breath is also very important to make sure that they're not having any trouble breathing. Obviously, you do want to contact your provider. Let's see, another question that's come up from the staff at Elwood Library. What is the best way to quarantine young children who cannot be without parental supervision for a lengthy period of time? So I thought this was a very good question, because yes, we do want to be quarantined if an adult gets diagnosed or is exposed to somebody at work perhaps and finds out that they may be positive. They do want to be quarantined in the home. But for children, we really don't recommend that. We're not recommending a small child to be isolated in an area of the home or kind of kept in their room. It's really important that you wash hands and maintain some proper hygiene, make sure that you're washing surfaces. But really for them to be isolated in the room, I'm not sure that's the best thing to do at that point, because once they've been diagnosed or once they've been positive, they've already been around the people in the home. So I'm talking specifically about the people in the home. So I'm not talking about outside, but within the home, those people have been exposed, and it's better to maintain a little bit of distancing. But if a small child is positive, I don't think it's completely necessary to isolate them completely. So I don't know if that's making sense, but you want to practice safety. You want to have the child be safe. So you want to be able to make sure that they're being observed, that you're okay, that you're tracking their temperature, that they're hydrated, that they're getting proper rest and proper food and drink. So that's all part of making sure that they're okay. So I thought that was very interesting, and I wanted to reiterate that it's really important that you take care of children that are not feeling well. Besides masks and gloves, are there any additional precautions parents can take to prevent the spread to the rest of the family? And this is also a very good question. So masks and gloves, you really don't need to use those inside the house, inside your home. So inside the home, you really want to you wash hands frequently and clean and disinfect all the surfaces. And make sure that they're using, like after they use the bathroom or any towels that they're using, that be washed frequently, and you make sure that you stay on top of, just general cleanliness and maintenance of hygiene in those cases. So I guess gloves. So gloves are not as important as you would think. The mask definitely. And I also want to point out with the mask, you really want to only have children that will not take it off or not touch their face. So the American Academy of Pediatrics is suggesting that children can wear masks if they're over 2 or 3. But even older than that, if they don't like it, or if they don't like having something on their face and they're constantly touching their face because you placed the mask on them and you're going to be going outside, then it's not worth the mask on the children. For adults, when you do place your mask on, once you put that mask on, try not to touch that area. That's really important. And that's why the initial recommendation weeks ago, when first things started happening, the recommendation was not to wear a mask, because the thinking was that maybe a mask will make us touch our face more, which that'll eventually also lead to spreading of the virus. So as we know, when we contact something with our hands and then we touch our face, especially our mouth or our eyes, that's where it kind of gets enter the body. So if we are touching our face frequently because of the mask, it kind of takes away the reason why you have the mask. So, but having said that, the the recommendations now currently obviously are to wear the mask at all times if you're going to be in an area that it's hard to maintain social distancing. So in the grocery store or in a setting where you might be coming across more people. So anybody that's coming into our office is required to wear a mask. We're all wearing masks in our office as well. And that's because it does minimize the contagiousness. So let's say you may have it, you don't know, and someone else may have it, they don't know. If we're both wearing masks and talking to each other and I sneeze by accident, it'll minimize how much my respiratory droplets get spread through my mask, and it'll also minimize that person's absorption of the respiratory droplets. So it really does help to minimize that. But I just wanted to just really point out that children under 2 should not be wearing a mask. So we had that issue where, you know, even smaller children were coming in with masks, so we had to really suggest that they don't, because it can be a choking hazard and a suffocation risk. And obviously, if any of your children, or if even an adult, you feel like difficulty breathing or you feel claustrophobic from wearing your mask, you know, then try to limit, you know, well, the cloth masks are a little bit better in making you feel like you can't breathe. But obviously, if you're having difficulty, you need to talk to someone. And I do have, okay, Holly David, surgical mask or cloth mask preferred. So both masks do work well. We do know that there has been a shortage of the surgical masks for frontline and healthcare providers. So if you have the mask already, that's fine, but a cloth mask works just as well, because you're really not trying to decrease the particle exchange. Like the actual coronavirus is very tiny. So the only mask that really works in that setting, and if you're going to be exposed in a high kind of contagion environment, for example, if someone is in the hospital and requires intubation, that is a high spreading event, it's called, and that is the N95 mask. And that is really only used for those types of situations. So everything else, a surgical mask or a regular cloth mask, a bandana, has found to help because it's a low respiratory volume that you're going to be exposed to when you're doing your day-to-day activities. And then there are a few questions on here that I want to tackle about the antibodies. So yes, that's the current release now is the antibodies. So I do get a lot of questions about that from parents as well for their children. So there's many different tests that are currently on the market, and it's difficult to say which one's better than the other. So at this point, what we're recommending is to see which test kind of comes out to be the best one. So basically, it's an antibody test that tests for your antibodies that you built up to the virus. So there's 2 different antibodies, IgG and IgM, and I'm sure you've been reading a little bit about it. So the IgG is your long-term antibody, and that's a lot of the main testing that's taking place. But the IgM is your short-term antibody. So if anybody's I try to explain it by comparing it to similar to how we test for mono, which is also a virus. The mononucleosis virus is a virus that we test for after the child has presented with symptoms, and we need to wait 5 to 7 days to make sure that your body has made an antibody response, and then we test it. Now, specifically for mono, you can have a false positive, which means kind of common, or a false negative. So you can have both those scenarios. So false positive is that there's another virus in your body that cross-reacts and causes it to come out positive. So that can also happen with other viruses as well. And if you are slightly immunocompromised or your body doesn't make as strong antibodies, it can come out negative when you may have some antibodies. So there is some questioning about those testing. I think we need to do, there needs to be a little bit more time. I think they will perfect it. And I think it will be something that most people will have to do in the, in the future. But I'm not sure it's something that we all need to do right away. Let's see. So, the other thing, let me see, I'm just looking at my notes. Okay, so this was a really important question that I got from the staff at Elwood Public Library. So how do you explain to children what is going on in the world without frightening them? So this is a very good question. And you really have to talk to your children. They understand a little bit about what's going on. I mean, depending on the age, but most children do understand when we ourselves as parents are a little bit anxious or not sure of what's happening. And so our children are sensing that, and they are aware of that. And obviously they're not in school, they're not seeing their grandparents. We're at home a little bit more. So all these changes that are happening do impact them. So the discussion is really around, first of all, open-ended questions. So kind of ask them what they understand about it, or what they know about it, or what they've heard about it, and kind of take it from there. You can't really give them like kind of platitudes. Like you can't really say, okay, everything's going to be fine. You can, I mean, what I meant to say is not that you can't say everything's going to be fine. Everything will be fine, but you can say you want to be truthful to them. You want to let them know that even though there's a lot of unknown, that we are going to get through this together. That there are people helping us. That if, God forbid, one person in the family does not feel well or is getting sick, we do have helpers that are going to help us. We do have good medical care. We do have good hospitals and good doctors' offices and good people around us that help. We have people that will help if somebody in the family gets sick. And you do want to reassure them, and you also want to give them hope. You want to be hopeful, and we all want to be hopeful. So really, you want to make sure that they and us, we see a good future in this, that we're going to come out of this even stronger and even better. And you want to impart that to them, but you also want to give them, you also want to, kind of discuss what you're doing to help yourself out. Like, oh, we can't see grandma, but maybe we're going to FaceTime her a little bit more. Or let me teach you how to do that on the iPad so you can talk to her a little bit more. So you want to give them some things that they can do to even help you, and that strengthens everybody. Because children, what I've learned, and I'm sure you know from your own children, is that they're very resilient. And we can learn a lot from our own children. We can learn a lot from them. And how do you deal with the anger, resentment, and fear in young children caused by social distancing? Yes, so there are many, many different reactions that our children and adults are having. And as time goes on, it changes. It's not going to be the same day to day. Some children are going to be, we're okay in the beginning. They kind of, took it in stride, but now we're in week 6 or in week 7, and it's getting a little bit difficult. And, the sameness of it is getting a little tougher. But again, children, have different ways to express themselves, and you have to allow them a safe way to express themselves. So if they're getting angry, or they're getting, irritable, or they're saying things maybe that they usually don't say, take a break. Take a deep breath, for both people, or at least, let them vent in an area that's safe for them, but they can vent. Try to walk away if you're getting upset too, because first and foremost, we want to be safe. We want to keep our children safe, and we want to be safe. And that goes back to filling our own cup, right? We have to really fill our own cup and make sure that we're okay so that we can help our children get through this. And maybe in a later quiet moment, talk to them and, see if there was anything that you could have done or that they could have done that could have been a little bit easier to handle, or maybe try to talk to them about what they were feeling, and that it's okay to be angry. It's okay to be angry, because again, this was no one's fault. There's no one to really blame. It's something that's outside of our control, and we kind of have to just get through it together. And that's what we have to tell our kids. And we kind of have to try to model the behavior, but as parents, I know what I tell my kids and my oldest all the time is that I learn a lot from them, right? We learn a lot from our children. So sometimes how they handle things might be mimicking how we ourselves may be handling it, right? So you have to kind of take that into account a little bit. But give yourself a break as a parent, and even just generally as adults in this pandemic. It's hard, and you have to kind of give yourself a break too sometimes, and that's okay. That's okay. Let's see. How do you deal? Yes. Okay. And this is probably affecting, a lot of kids too, but how do you deal with older children and their depression over missing things that their siblings were able to do, like prom, graduation, college visitation? So yes, the class of 2020, my heart goes out to them. And again, you have to kind of tell them that we'll get through this together. This is something that nobody could have predicted in their wildest nightmares. And that, everyone is trying to do the best that they can and trying to help them to achieve the best closure possible, or the best kind of transition period possible, the best way to get through this time. And although your children are upset, and we can't minimize that, right? We can't say, you don't want to say to them, oh, well, there'll be other things, or, you really don't want to minimize what they're feeling. You want to let them know that you want to validate their feelings. You want to let them express how they're feeling, even their anger or their resentment, but try to look forward to some, like another different thing that they could celebrate. Like maybe when things get a little bit better, or the social distancing is a little bit less, we can do something else to celebrate your achievement. Maybe in the future, maybe not right at the end of the year when we usually celebrate these things, maybe it could be a little bit later. And we'll be able to have maybe grandma and grandpa over to help you to celebrate. So, there are different ways, but you do want to kind of, give them a hug. This is a time when we need to hug our children, say, I love you to them as much as you can, and just, really be with them. And also you want to let your kids know, especially the older ones that are used to driving and being outside. If you have a college age child at home, or they're adults, I guess, but they're back home with you. I mean, they've experienced life outside and went to college, and now they're back home with you, and they're not seeing their friends. They're staying at home. You want to commend them for that. You want to tell them that they're doing a great thing by staying home and being responsible and practicing social distancing, and they're benefiting everyone else around them. They're benefiting the adults in the home. They're benefiting everybody around them by not going out with their friends. So you want to accentuate the positive. You want to give positive feedback as much as you can. That's really important. And of course, of course, if you feel that your child may be if you feel that your child may be exhibiting signs of perhaps severe depression or severe anxiety, or things that you think that you cannot manage on your own, or they maybe have a history of something else, reach out to your doctor, reach out to, there's lots of resources that we have for you. There's a lot of things that we can do by telemedicine. You call the office and we can discuss with you, not only, most of the pediatric offices in the area, and I'm friends with a lot of the local pediatricians. We all have access to a possible telemed visit or a phone call. If someone is in trouble or you feel that the things are not going so well, things are outside of even the help that you can give, reach out, because there's a lot of resources. Mental health is so important right now. And we know that, and we can provide the resources that you need. And another thing I wanted to touch on is depression and anxiety, or those kind of feelings don't look the same in all children of all ages. So, and some kids are not going to come right out and say, you know what, I'm really depressed. They're going to show it in different ways. So they can show it by having a decrease in appetite. They can show it by having, by sleeping, their change in sleep habits. So they can sleep a lot more, or even a lot less. They can have difficulty sleeping at night. They can change their sleeping patterns. They can become very quiet. They can become very reserved. They can, depending on their ages, they can all of a sudden, if they were usually the happy, child that was running all over the house, and now all of a sudden they're quiet in their rooms, that's a change. And that, doesn't necessarily, it could be manifestation of, something that they're thinking about, like stress. Stomach aches. I have to say, stomach aches, even before the pandemic, stomach aches were probably the most common, like stress was one of the most common reasons that kids would come in with stomach aches and belly pains. And so, of course, you want to talk to your primary provider. Again, you want to give your pediatrician or your family care practitioner a call regarding any symptoms that your child may be having. But if everything else kind of checks out, it could be stress related. We've been seeing kids with sometimes even cold sores or canker sores that arise because they're just feeling so stressed, and that's how it kind of comes out in the body with no other really symptoms. So, and then let me see. I think, did I skip a page? No. Okay. Oh, and then I really like this question. So what about kids who are having such a good time at home who don't even want to go back to school? And what about the kids that are fearful about going back to school for other reasons, like the school being contaminated or their friends getting them sick? So yes, so how are we going to transition, once we're on the other side, kind of, how are we going to transition back? Well, it's going to be difficult because it is going to be a new adjustment, because we're doing a new adjustment now. So the same way we kind of adjusted to this new way of learning at home and social distancing and getting all our schoolwork online and on Zoom. And I have to thank all the teachers in the area, like every single one of anybody that deals with children on a school day-to-day level. Wow, you guys have done amazing. I mean, within like a couple of days, you had everything set up, you had everything, going strong. And as a parent, I truly appreciate that. And I can think the kids, they do appreciate that too. But yeah, the transition back to school, and it may not be the same way that we're used to. There may be some changes, and it's important to kind of, talk about that a little bit, that there may be some changes going forward. But that too, we will adjust to, and we will get through it with, mutual support and mutual guidance. And just like the homeschooling option was slowly kind of put in place, and there's still some children getting adjusted to it. The same thing will happen on the other side. When we have to go back to school, there will be some children that really don't want to go back because they're scared and frightened, and that's okay. And we'll get through that, and we'll help them through it too. Again, yeah, I always go back to how children are so very resilient. I mean, my 20 years, over 20 years in pediatrics have taught me that we can learn so much from the children. They will probably let us know the best way to get back. Oh, yes. How could I forget that? Holly David, you said such a great thing. Yes. So the American Academy of Pediatrics is strongly recommending, and that's the main reason why my office and many pediatricians' offices are still open and actively seeing patients, is because we are very much so recommending that we stay on the vaccination schedule as close to as much as possible. So the first couple of weeks and over the next few weeks, I know in our office we're going to slowly try to increase some of the older children. But right now what we're seeing mostly is under 2 years old with the essential vaccine visits. So we're bringing them in very safely. We're only having, no one's in the waiting room at that time when you come in. And we're only seeing the essential vaccine visits. So at 2 months, 4 months, 6 months, at the 12, 15, and 18 months, and then at 2. So those are the ages, and those are very important milestone ages too. So we do a lot of developmental assessment as well. But we do really recommend those visits to stay in place. And of course, another reason why we're in the office as well, and we still actively see newborns. So babies are being delivered. They are being delivered. We're still having pregnancy and moms coming in, and so that new life is coming. So we're still seeing the babies. Thank goodness. I love all ages, but the babies are amazing. So we still see the mom and the baby 24 to 48 hours after discharge, and as all pediatricians do. And that visit is so important to make sure that your transition to home was okay and everything was well. And then we do see a little bit after that, but we do a lot of televisits too to keep everybody safe. So let's see. Was messaging turned off? All right, so I went through all the questions that got through here. I went through all the questions that that the library staff sent in. I'm not sure if I missed anything. I'm so happy I got to do this. Too bad it's not two-way, because I'm enjoying seeing all your comments and things. I hope this was helpful a little bit. Let's see. So, I mean, I think the most important thing, the other thing I wanted to touch on was just to have a routine in place for the kids. So for the smaller children, you want to make sure that you have, we're calling it bath, book, and bed. So these are things, just for the younger children, in case you've kind of gotten away from it, like some of us here too, we've kind of gotten away from the whole bedtime schedule. But you want to have a kind of a routine. So nowadays, definitely our weekends kind of go into our weekdays. We don't really know what day it is sometimes. But it's really important that for the kids that you maintain some type of routine. So it doesn't have to be exactly like the school days were. You can kind of do, in the morning, you want to have breakfast, maybe a little bit of playtime, and then a snack, and then maybe you can start the schoolwork then, and then lunch, and then outside time. So outside time is really important. That's really the sun does really help. Vitamin D, the sunlight, it really does help to get out there and do some activity. Even your older kids, your younger I mean, of course, while practicing social distancing, but it is really important to get some activity outside, anything, just even, just run, just even a walk. But being outside is really, really helpful. And then, doing some of your schoolwork, a snack, and then dinner, and then, some quiet time at night. And then try to have a bedtime that's the same pretty much every night. So the same bedtime and then the same awake time. So another question I get a lot at work from some of the parents is that the bedtimes have gotten kind of out of hand, especially with the older kids. Sometimes they kind of, get kind of just used to where they are sleeping at midnight or 1, and then they're waking up at like 12, 1, and then it kind of cycles. So you kind of have to, set a time, sit down, set a time with parent and child, and make it a discussion, and kind of work together on that. It's really important to try to maintain a schedule. I mean, like I said at the beginning, really give yourselves a break though. Like don't try to, I read so many things where people were, learning a new instrument and learning a new language, and I'm 7 weeks in, and you almost feel like a failure, like, oh, I didn't relearn French that I took in high school. No, don't do that. You want to give yourself a little bit of break and time, and this is a mental stress for all of us, right? So same with the kids. If you're trying to change their habits that kind of they've gotten into for the past couple of weeks, it's not going to change right away. You have to kind of give it time. You have to give them time, and you kind of have to work together on it. So, yeah. And, let's see, did you guys have any other questions or concerns? Specific, not specific, you should talk to your about, but, I'm ready to be here and to do this with you guys. And if there's any other, subject matter or anything that you wanted me to talk about or address, I think it's a good idea to connect. Screen time. There's a big question about screen time a lot. So the American Academy of Pediatrics has always suggested that prior to the pandemic that we do less than 1 hour a day. So obviously those guidelines, the specific guidelines has not changed. So it's not that the American Academy of Pediatrics is suggesting that you go and you watch your screen all day, but they do say that, oh, thank you. They do say that it is important to FaceTime relatives because that is really good feedback for definitely, children of all ages, even infants. It's really, really important for infants and children under 2 to FaceTime other people because they really do need the socialization. So they need the socialization from parents, of course, and you want to reach to them as much as you can, and you want to talk to them, and you want to really have good face-to-face contact with them. But really FaceTiming or even a Zoom with the extended family is so important for your younger children because they're really unfortunately missing that aspect right now of socializing, of seeing different faces and different smiles and different voices. I have to tell you, it's really amazing when I examine the babies now in the office, and we're seeing, under 6-month-olds. All the kids under 2, the under 6-month-olds, or especially even the 2-month-olds, they still smile back at me. So I'm wearing my mask. They can't see my smile. But when I examine them and they look into my eyes and they make eye contact with me, they're smiling. They start smiling at me. And it's so nice that they can recognize that I'm smiling back at them, but they can't see it. But they know. I mean, I find that completely amazing. And I always comment on that. And it's really an amazing, an amazing thing that the infants do every stage. And, the other thing that also is important to note is that we do all of a sudden have a little bit more time with our children. If you do, I mean, if you are able, if for those of us that are on more of the front line. So myself, we're in like more of a private practice or a practice. So, but the frontline workers in the hospitals, yes, it's a little bit, a lot more tough for them. But the people that are home with their children, or hug them, talk to them. I mean, all of a sudden you have a little bit more time. I know even with myself, because we are, it's a little bit less people in the office, so we're getting home a little bit earlier, and I'm able to spend a little bit more time. The kids aren't running around with their activities. There's really, I have my oldest son at home, and you can kind of, enjoy that part of it a little bit more. This, so you have to see try to see the good in a little bit of it. For those of you who may have, someone that's not feeling well or has lost someone, my heart goes out to you. I'm so sorry for your loss. It is a difficult time for many of us. It's unfathomable how much of this is going on around us. And the children kind of do get aware when we're upset or hurting, or someone in the family is sick or not feeling well or has passed away. You do want to discuss it with them and make sure that that they're okay, and again, we can learn from them as well. The other thing I want to mention, maybe a little more important, one thing that I tell obviously you have your inhalers. We're also recommending that those people that have the nebulizers to not use those right now. So the nebulizer, which is the medication that it's like a mist that develops. It's a machine that basically gives out the mist, and you breathe it in for if you're having an asthma exacerbation. So if you have a nebulizer, it's recommended to not use that currently and to stick with the inhaler, because the nebulizer can impart more particles or more respiratory particles into the air, and that sometimes can spread if there's a particular virus or COVID-19, it can spread it farther into the home, so it can be a little bit more dangerous for the people, children around, or the people around them. So we are recommending that. And yes, we are. The other thing that has been happening, because the kids are at home, we're seeing a little bit more injuries, unfortunately, and sometimes we're seeing a little bit more ingestion. So we want to be careful about small children and exposures to, because all of a sudden, kids are home more. If they were in a daycare setting before, when we were working and they were in daycare, they're at home more. So you do want to make sure that all your cleaning supplies, and I know we all have like the Clorox kind of outside now everywhere because we're using it a lot, but you want to make sure all your cleaning supplies and things like that are still locked up, that none of the children have access to them, because we are getting a few phone calls regarding that, and you want to have the number for poison control on hand, because we have been having to give that out a little bit more. And the injuries, we're seeing like the falls and things like that, because the kids are running around outside, which is okay. But make sure if they're riding a bike, you want to wear a helmet, and you want to be safe doing those things too. You want to make sure that they're not like in the street or in a busy street or anything. So, yeah. Let's see. I mean, I can talk. I like to talk, so I can talk a lot. I can go over. Oh, so one thing that I did do is I try to give the kids a lesson in hand washing when I see them sometimes. So just to kind of go through that a lot. Again, I know that many of you have probably gone through this a little bit, but I like to just reiterate it and it's always a good thing to kind of let them know, because sometimes we do get a little, after we've explained something over and over again, you kind of stop, and then so now it's like a good reminder. But you really want to like wet your hands. Like I try to tell even my younger one, because I think at school, or when you're kind of busy or doing things, you like to do it really fast, but you really want to spend that time. So you want to wet your hands. And actually, if you have soap and water, it's actually better than hand sanitizer. So hand sanitizer is good. If you don't have soap and water, you can use hand sanitizer. But if there's soap and water and hand sanitizer, go for the soap and water. All right, so that's better. You want to wet your hands properly. You want to put the soap on, and you want to really like lather it up and get like everything in here, okay, in your fingers. And then you want to kind of get your palms over here, and you want to do the back too, but really the front and the back. And then most important, and this is what I have to tell my own son, and then when you kind of put it into the water, don't just go in and out. You're going to put it into the water and really wash all that soap off, because guess where all the bacteria and the viruses are? They're in that soap now. So the soap suds actually break down the virus particles, and they sit in the soap. So you have to wash off all the soap. It has to be completely washed off, okay? And then, of course, the 20 seconds, you want to rub for 20, 30 seconds, that's fine. And then you wash it all off. And then you want to dry on a clean towel. So you don't want to dry back on your hands or on your jeans or something like that, because then you're kind of back to where you were before you washed your hands. So you want to dry it on a clean towel. And then, you want to keep your hands clean, or if you were going to go eat, or you're going to go touch your face, you can do that right after you washed your hands. But once you kind of touch a surface, you don't want to touch your face anymore. So that's one thing. And the other thing I wanted to touch on also, because all of us are washing our hands so frequently, another lot of phone calls that I'm getting is about getting dry skin or eczema on the skin. So definitely, if you have like dry skin, our skin is our biggest organ that's protecting us, actually. And we always forget about our skin, but our skin is our biggest organ. So you want to keep the skin on your hands nice and intact. So when you're washing your hands a lot and you're kind of using all that hand sanitizer and the antibacterial soap, it does tend to dry out your skin a lot. So you don't want the cracks in your skin to have, to start like getting cut or bleeding, because what can happen is that can be a nidus for infection. Like germs can enter your skin through that way. So you want to keep your skin intact. So what I'm trying to say is try to moisturize after you have your hands washed. Even for the kids, make sure they're moisturizing at the end of the day, and that'll help to protect their skin. Once the weather starts getting a little better and it's not as cold, it will get better. Our skin will get a little bit better automatically. But if you have severe dry skin or something called eczema or contact dermatitis, you may want to call your doctor or call your provider, because there are some creams that we can give to help you manage that and to make sure your skin is intact. So it's really important for our skin to be intact right now too. Well, all the time, but especially now too, to make sure. Allergies versus virus. Oh, no problem. It's okay to join late. Allergies versus virus. Okay. So that's the issue, right? So with children especially, it's difficult sometimes to tell because their symptoms can be so mild. So the important thing is for any cough, and that's why one of the universal masking was recommended, because there can be instances where you do have allergies, but you may be an asymptomatic carrier, or the child may have allergies and may be an asymptomatic carrier. So when they cough because of their allergies, not because they've, succumbed to the virus, but they're still spreading the virus that way. So the universal masks help in those instances too. So let's say if I have allergies and I'm coughing, but I may have harbored the virus because of my line of work and at work. If I'm in the grocery store and I start coughing, if I have a mask on and the person next to me getting the oranges also has a mask on, it'll help protect them from me. And that's one of the main reasons why we wear masks. All of us wear masks in the office now too, is because I'm protecting you from me. So we do, you know, lots of hand washing. We wipe down everything. We wipe down the whole office with bleach and everything before we set up the next patient in that room. But myself wearing a mask is protecting you from me. So that's, you know, that's also another reason why that we recommend the universal masking. So this has been really, really fun. I again thank the Elwood Public Library for allowing me this platform and for inviting me to do this. I would love to come back and talk about anything that's on anyone's mind. I really implore you to reach out to your pediatrician or physician if you have any specific concerns or questions. There are a lot of resources for like mental health management and just in general, like we can give you lots of resources to help you, to guide you. You know, one of the websites that I wanted to actually mention, a lot of information is on, it's called healthychildren.org. So it's I should have written it down, maybe held it up, but it's the American Academy of Pediatrics website. It's run by a group of pediatricians, and it's very parent friendly. It has a lot of information, but there's a separate whole bar for specific COVID-19 related, and it's www.healthychildren.org. And there's a lot of useful information on that. Regarding specific, you know, children, you know, specific, lots of different like bedtime and feeding and just general pediatric kind of stuff. But of course, you can always call us and we're happy to talk. And, you know, I love to talk. Actually, I have to tell you, one of my nurses always says that I need an eject button from my rooms because sometimes I spend too much time in the rooms, and sometimes I do get a little backed up, but you know, I do miss you know, seeing everyone. And yes, thank you. Great, that's great, Mr. Eric. Thank you so much. I do miss everyone. I do miss seeing everyone. I you know, hopefully we'll come out of this stronger than before. And I think I do have faith in humanity, and I do have faith in my fellow neighbor and my friends and everyone. I have a lot of faith in us, and I know that everything will get through this. We will get through this. So I think I'm going to leave it at that. I hope you guys all have a really great night. This was fun. I wish I could see you because I like doing this. But you know, I hope it was helpful, and I hope that everybody has a great night and stay safe and stay well. And please reach out. Please reach out if you need me, or if you you know, need your doctor, your pediatrician, or you know, we're here for you. We are. All right. Thank you. Thank you. All right, I'm going to end it there. Bye. Good night.